How much is too much? All right, what is just a good gauge for families to know how much morphine is too much?
It really depends on the patient.
Perfect.
If the patient has been on heavy drugs or have had serious chronic pain issues, like they've been on methadone for years, they're going to go through morphine like water.
And it's not going to touch them too.
Yeah, because they have a higher tolerance for pain medication. And we may need to use higher doses of morphine in order to keep them comfortable.
Right.
Other patients are 80 pounds and they've never had a lick of Tylenol in their entire life. Okay, they're only going to need the teeniest, tiniest bit. Yeah. So we give them a range. And granted, the nurse is very involved in what we call titrating medications to find the right dose. We always start small and go up. Yeah. So there are ways for us to monitor, was that dose effective? Was it not? Do we need to go up? Was that dose overly effective and they are just so sedated and lethargic? Okay, let's pull back. And all of that has to do with assessment and behavior. And you really do need a nurse holding your hand through it, because we are experts in understanding, okay, that was too much. We don't need to do that too much. Morphine liquid. So some hospices will use a morphine pump, like if you have a port, if you're a cancer patient and you have a port, some hospices will use a pump. We use liquid medication, so oral liquid is a very small amount that's dissolved into their salivary glands, and so usually we start small with just 0.25, and then we'll go up and up and up depending on what their needs are. How is their body handling these symptoms? And then again, it just depends on what the needs are. How is the patient handling it? Morphine liquid doesn't stay in your body as quick or as long. So it usually what we do is our dosage accounts for giving it as often as every hour. Now, the smallest amount every hour over a 24-hour period of time, people look at that and they think, oh my gosh, that's so much. In reality, it's not. I have other chronic pain patients who've had 2 full mils of morphine, which is 40 milligrams every hour for days, because that's their chronic pain issue that they've been dealing with, and they can't swallow their pills anymore, so that's a big problem. There are other medications that are not pills that we can use in combination with the morphine, but again, all of that has to be so very carefully titrated and used so that we're not over sedating a patient.
If you're watching this video, this is actually a short clip, and here is the longer clip, the actual full-length CarePods video. So please click on it. Click on it. Like, go ahead. Here.